So my next question is more abstract. What do you think the future of orthopedics is like?
Yeah, it's a good question. So I think that I probably have a biased answer a little bit because I'm a spine surgeon. So the good news is that I think a lot of people were scared to apply for orthopedic because of what the job market was like a decade ago. And I think that it's important to have good facts. Is number one is unfortunately we've cut down the number of trainees in Canada, so there's less people going to orthopedics. And the second fact is that orthopedics is now more. There are more orthopedic procedures being done in North America than there are general surgery procedures. So we're now the busiest service in North America, and with an aging population with further advances in terms of better replacements, in terms of arthroplasty or spine or even foot and ankle, the demand for orthopedics is just going to continue to grow and grow and grow. So it's not a trend that's just a temporary thing that's going to reverse anytime soon. I think that there's going to be an ongoing need for more orthopedic surgery in the future. And our current workforce is aging. The average age of the orthopedic surgeon is up there. So I think that what's going to happen in the next 10 years is that there'll be a big demand for orthopedics and maybe an undersupply of surgeons. From the specifics of surgery itself, I think there's always a trend towards incorporating new technologies such as minimally invasive or arthroscopic or navigation and all these things. So the technology is allowing orthopedics to make further leaps and bounds. So for spine, for example, I wouldn't be surprised if 10 years from now, maybe spine becomes its own residency, where there's so much to learn between the cervical, thoracic, and lumbar spine, between degenerative and trauma and, um, you know, pediatrics, that all of a sudden we become our own residency. So those are things to look out for in the long term.